Yeah, let's go ahead and get started.
All right. Well, thank you all for coming. So good evening and welcome to both our in-person guests here at the Monroe County Public Library and our online guests attending via Zoom. Welcome. Thank you all for attending Safety for All at the Expense of None, a town hall on public safety in Bloomington, Indiana. Tonight's event is hosted by the Alternative for Public Safety Special Committee of the Community Advisory for Public Safety Commission. Our committee includes 3 commissioners, myself, Jason McCulloch, as well as Nejla Routsong, who's here in the room, and Kamala Brown-Sparks, who's joining us on Zoom. We realize there is a mayoral candidate forum tonight. However, this date was the only event or the only evening we were able to book the auditorium for this event. So we gladly appreciate those of you who are prioritized this event in your schedule. We also plan to continue our outreach for a few more weeks before submitting our report. So we encourage anyone you may know who was unable to attend tonight to contact us for one-on-one meetings to share their perspectives on public safety so we can include that in the report.
Cami, you can go ahead if you're ready. Cami, are you there? Is her mic, is she able to unmute? We have an online presenter.
Tonight's agenda has 3 parts. First, we will share a short presentation explaining our commission and the work we are doing on alternative public safety in Bloomington. Then we will go into smaller breakout groups where facilitators from the CJAM will help us speak about our own experience with public safety, listen to others who are from different backgrounds, and reflect on what we heard so far and where we might like to change and things in our community. Finally, the in-person attendees will all come back into the library auditorium for the closing session, where we will share some results from the surveys you took when you registered, some of the results from our one-on-one outreach with key stakeholders that we have conducted so far, as well as hear from facilitators on what some of the key ideas that we heard from the breakout sessions tonight.
We are a city commission that was created by the Common Council in May 2020. Around the time of the George Floyd protests rocking cities across the nation, all of our commission members have experienced. Thank you. We're on slide number 3. All of our commission members have experience advocating for people who are marginalized in their societies, such as racial minorities, people with disabilities, or people who are socioeconomically marginalized. Our commission was established to help advise the city on how it might improve the safety of all residents by identifying the unmet safety needs of the most marginalized, unsafe, or vulnerable residents first. This is a harm reduction-based approach. In the 3 years since we were established, we have worked towards making several such recommendations to the city. Our first 3 resolutions passed by the CAPS Commission have protected the safety of Muslim residents, Jewish residents, and those people who can become pregnant. You can read those 3 resolutions on our website. In each of those resolutions, we first performed research on the issue as well as community outreach with those most affected by these problems before making our final recommendations to the city. For the project of advising on alternative public safety programs, we first agreed on our process, which we are going to tell you about next. Then we performed coordinated individual research on the best practices and major challenges on this topic. Finally, we formed a special committee for performing community outreach to hear from residents, organizations, and major stakeholders of Bloomington on what public safety means to them. In short, we're people just like you who want your help in making our community a safer place for everybody. Our commission is also joined today in this project by two other organizations from our community, CJAM, or three other organizations from our community, CJAM, Help Ourselves, Mutual Aid, and Net Impact IU. CJAM is the Community Justice and Mediation Center, a trusted community organization made up of staff and volunteers who mediate conflicts and facilitate discussions like this one in our community, using the model of restorative justice and participatory decision-making. We are also joined by volunteers from the Net Impact Club at IU, Kelley School of Business, who have undertaken evidence-based research on public safety policy approaches using local available data, such as public health, economic, and public safety data. We're also joined by volunteers from Help Ourselves, a mutual aid organization dedicated to serving communities. And they serve hot and nutritious meals to the public 3 times a week at Seminary Park, as well as distributing first aid and harm reduction supplies to the people of Bloomington. We are extremely grateful to CJAM, Net Impact, and Help Ourselves for their work and assistance in producing this event. Next slide, please.
Cool. So the aim of our work on alternative public safety is to reduce crime, costs, and injustice for all residents in Bloomington, or in other words, to improve public safety for everyone.
Next slide.
Our goals are: 1, to recommend a community-led alternative public safety program based on the principles of poverty decriminalization, human dignity, racial equity, harm reduction, and restorative justice. 2, to empower our community to have maximum control over program design, implementation, and oversight. 3, to ensure sustainability of the program through detailed recommendations for budgeting plans, institutional partners, staffing, and key performance indicators.
Our process has 3 steps. First, we performed research including studying the most successful cases of alternative public safety programs around the nation and some outside of the U.S., including contacting and interviewing operators of these programs in most cases to find out what they would do better and what worked best. Then we started performing one-on-one outreach with key institutional and organizational stakeholders in our community to find out more about how they view safety in our community, such as public safety department officials, city officials, representatives from nonprofit specialists, local business representatives, and advocacy organizations. We have not yet finished all of the one-on-one outreach we plan to perform, but we have finished most of it and are excited to share some data from those interviews at the closing of our event. Now we're in the stage of engaging the public to find out what our community safety needs are from a citizen, street-level perspective, particularly aiming to engage the people in our community whose safety needs might be overlooked by our current public safety practices. Finally, when we have finished hearing from everyone in our community who wants to speak to us about this topic, we will complete our final analysis and recommendations based on the culmination of this work to the Commission, where we will then discuss and vote on the recommendations. If passed by the Commission, the recommendations will be sent to the city, including the Mayor's Office and the Common Council, where they will decide whether and how to implement our recommendations. Next slide.
So here's a slide showing our timeline. As you can see, we completed our research in February, as Najla just spoke to, and we plan to complete our outreach in May. So after that outreach, we can deliver our recommendations to the commission in June.
Our main findings were, first, humans have basic needs, and when our needs are not adequately met, we will do whatever it takes to meet those needs. Whether or not we design a society that meets everyone's needs does not change the fact that those needs will continue to exist. This means that meeting the basic needs of everyone in our community is the only long-term sustainable way to prevent crime in any society. For example, let's take a common issue for residents in Bloomington: housing affordability. When I was in house in Bloomington, I had no options but to break numerous laws every day simply to live, between loitering, soliciting, littering, sleeping in parks, etc. There is hardly anything I could do as a healthy and safe human being residing in our city that did not violate the law. Yet none of these so-called criminal acts threaten the safety of others. On the other hand, our city's law enforcement officers are routinely expected to enforce laws which directly endanger the safety of our city's residents. When they forcibly remove the encampments of unhoused people from a public space, or when they remove people from their homes through eviction, or when they place a person under arrest for low-level crimes like possession of drugs. The words public safety are commonly taken as synonyms for law enforcement in our society, but our special committee has learned through our research that many laws, when enforced, in fact, directly endanger the safety of our minority residents. In fact, studies conducted over 60 years on city police expenditures and violent crime rates show no correlation with higher police spending and violent crime. What these studies have found conclusively, however, is that higher police department spending consistently increases one thing: misdemeanor arrests for low-level crime. These are arrests for nonviolent crimes which create disproportionate harm and injustice against people living in communities of color and marginalized people such as the unhoused, disabled, or drug users. So in many ways, increased spending and hiring in police departments can and do create more harm, more injustice, and raise costs, all without reducing violent crime. On the other hand, directly meeting the basic needs of people through increased access to housing, health care, especially mental health care, and drug treatment has definitively shown to reduce crime in a cost-effective way. Furthermore, community policing, or using unarmed but highly trained peer responders to respond to nonviolent emergencies, has been shown not to increase misdemeanor arrests or injustice for marginalized people as higher police spending does. In fact, studies that have been done on the community policing program in Denver show that it led to a 34% decrease in low-level nonviolent crimes, while violent crimes did not increase at all, as many police advocates had feared and said that they would. Cost-wise, the community program in Denver cost the city around 25%, or 1/4 of the budget of policing, to reduce the same number of crimes. That means community policing programs may be 4 times as cost effective as raising police budgets, and without the negative effects that lead to social injustice for marginalized people in our communities. So when we confuse law enforcement with public safety, this actually hides the reality that our laws make some people in our community safer and others less safe. Therefore, our approach and the name of this event is Safety for All, because we want to help our city decide what safety for all at the expense of none would look like to achieve in Bloomington and what a community-led approach to that might look like. We have also found in our research that all communities are different and each community knows what's best with their own safety needs are. That's why tonight we have asked CJAM to help us ask you all what Bloomington's biggest unmet safety needs are and to help us recommend ways that we might meet those needs in sustainable, equitable, creative, dignified, and other Bloomington-worthy ways.
Next slide. This is a photo this is a photo actually of Denver's community policing program at work, actually. I think it's from USA Today. Some of the best practices we have found from around the US in reducing crime, costs, and injustice are: 1, crisis response systems that are community-led, peer-staffed, and non-coercive for responding to non-violent calls for help. We studied several alternative crisis response approaches from around the US and found that the characteristics that make them the most successful are that they should be unarmed, which means they are non-coercive, staffed by people with lived experience in the area in which callers are suffering, and with experience advocating for those people. Furthermore, in the best systems, there was a separate phone number provided to the public to call that response team to ensure it would not be answered by an armed officer. 2, resilient, self-organized neighborhoods. When we stop viewing public safety from the lens of law enforcement and start seeing it as resilience and strength, the neighborhoods become important. A resilient, stable city is one with strong, resilient neighborhoods. Strong neighborhoods are ones where neighbors know each other and work together to resolve their needs. The main challenges to strong and resilient neighborhoods are a lack of economic resources, a lack of organization, and a lack of social justice. That's why some of the safest communities we saw in our study are ones where the city supports neighborhood networks, providing them with the administrative and economic support as well as conflict resolution needed to meet their own needs in these areas. Third, we found that care first cuts costs. Just as housing first models have been shown to significantly reduce the costs associated with policing, arresting, incarcerating people who would otherwise be unhoused, other approaches to meeting human needs have the same effect. It is much more cost effective for us to prevent crimes from being committed by people rather than to wait for them to be committed and then control, arrest, and incarcerate those who commit them later. It saves money, reduces crime, and it reduces the number of people induced to become criminals. This is simply the only humane approach in a society where we have the resources for everyone to live safely. Why should we exclude anyone from that safety? Our research tells us we should not exclude anyone. And in fact, by doing so, we are violating these people's basic human rights and their human dignity.
Mind the gap. That space where public safety seems to be in scarce supply. For instance, the gap that sometimes exists between law enforcement and public safety, where safety can only be had for someone seemingly at the expense of another's safety, is what we plan to focus on tonight. Because our work has shown that, materially speaking, there is no necessity to sacrifice or neglect even one person's safety for another person's. Public safety should not be a scarce resource. We can live in a community where everyone has their basic needs met, producing a public safety that lives up to its name. For instance, with the previous example of housing, would you believe me if I told you that our community already has all the resources it needs to house every person in the community right now? In fact, according to the latest housing market analysis on the city's website, Bloomington already has around 10 times the number of vacant housing units for every unhoused family living here. Furthermore, a 2019 study called The Business of Homelessness, conducted by the Picture of Homeless Research Committee, found that most cities spending many times more on managing the homelessness than they spend many more times on managing homelessness than the cost of permanently providing housing for all homeless citizens. Between spending on temporary shelter, medical services, private security, extra policing, prosecuting, and incarceration of unhoused people, our own community also likely spends many times more than the costs of directly providing that basic housing for all. Of course, lack of access to affordable and safe housing is only one of the unmet basic needs that drive crime in our community. But we use this example because it is one of the more prominent ones and one of the more basic. This same fallacious thinking, though, leads to sacrificing one person's safety for another's, and that's at play with many other types of unmet human needs in our society. Tonight, we would like to shine light on and explore how we might close this space, the space where we are depriving people of their basic human needs, because this is the number one way closing that gap is the number one way we have found to reduce crime in a sustainable, evidence-based way.
Some community policing is proven to dramatically reduce costs, social injustice, and low-level crime. But what about violent crime and homicide? The crimes that we want police to be making more arrests for. And what are the systemic causes of homelessness, drug use, and mental illness, which all seem like drivers of all kinds of crime in Bloomington? Recent economic and epidemiological evidence shows that economic inequality, or the disparity in wealth and income among all the people living in a community, is a reliable predictor in rising rates of all these things. In fact, income inequality is an even a stronger predictor of mental illness, drug use, violence, and homicide compared to absolute levels of poverty. That's right, living in a community with high disparity among the richest and the poorest leads to worse social outcomes than comparable communities where everyone is slightly poor or even impoverished. So where does Bloomington fall on that scale? According to the latest county health rankings published by University of Wisconsin using 5 years of data, Monroe County has the highest income inequality of all 92 counties of Indiana. The scientific and historical evidence is overwhelmingly conclusive. All of us, regardless of our income or social status, are only truly as safe and secure as the most vulnerable and marginalized people living in our community. So why do so many of our local public safety discussions center around questions of how high to raise police budgets, or whether to build bigger jails, rather than how we might reduce income inequality? Well, we think it's simply because not enough people are aware of the scientific evidence around the systemic causes of crime and violence, or the proven effects of higher police budgets versus community policing programs.
Next slide. With that said, we know that each community is different, and our city's public safety needs are going to be different than any other communities. So now we want to hear about Bloomington's public safety needs from you. So here are 3 questions to start you thinking on your way to the breakout rooms. 1, what are your unmet safety needs and those of your family? 2, who's currently being excluded by our institutions of public safety? And how might we try to bring those people inside of that circle of safety? 3, What challenges do you foresee to changing the way that our city views public safety? Next slide.
So now we'll break up into smaller groups so you can share your experiences in a more intimate and safe setting. You can reflect on what we hear. We'll reflect on what we hear and deliberate on some important questions. If you have a blue dot, you will go to room 1B. If you have a red dot, you will go to room 1C. And if you have no dot, then you'll go to room 215.
2A. It was a typo.
Oh, it's 2A.
Yeah, it's 2A.
Well,
It's upstairs.
the good news is that our volunteers will help you find these rooms. If you are participating online, we have made a room for you. You will be in a Zoom room and for the breakout exercises. So now let's go to our room assignments, and please don't hesitate to visit the restrooms on the way. Thank you. All right, well, welcome back. Welcome back to Safety for All at the Expense of None, a town hall on public safety in Bloomington. Thank you so much for sharing your experiences in public safety with others in the breakout rooms. We look forward to collecting the information gathered from this event and using it to make important decisions in our work. In the next 10 minutes, we will share some information about how to reach us, how to share next steps in this project, and finally, we'll share some results of the data that we have gathered so far from the pre-event survey and from key stakeholder outreach that we performed with institutional leaders in our community.
Okay. Oh, that's not my slide.
You know someone who is interested in public safety or in our commission's work, but was unable to attend our event? Or would you like to follow up or expand on some of your information that you shared tonight with us in more detail? Our committee will continue our community outreach during the month of April to make sure we have included everyone in the community who wants to be involved in our project. If you would like to schedule a one-on-one Zoom or in-person meeting with us to share your thoughts, here are the ways to contact us. The easiest way is to fill out one of the sign-up sheets being circulated in the audience now. You can also email or phone our commission staff liaison, Ash Kulak, at the information on this slide. Finally, you can always visit our commission's website on the city website under boards and commissions.
Next, we will invite our breakout group facilitators from CJAM to share with us the top-level themes that they heard in their breakout groups about how our community members view public safety and how we might improve public safety.
Wilson was able to come. Ash, can you let Wilson?
Okay, we'll start with the Zoom breakout facilitator.
Hello, can you all hear me? Hello, so what we talked about in our breakout rooms was issues that kind of surrounded crimes of poverty. So when we were talking about things that, we could do better, it was one of the things where how we need to stop criminalizing those who need help in our system by offering programs or alternative ways for them to receive help from like working with nonprofit groups, government organizations, and on top of all this, policy. So also using policy to create change and working with government officials to electing new ones to try to create an environment that allows public input. So allow public input to change, transform, and look for more evidence-based ways to create change in the community. Whether it's, and that doesn't disfranchise those with disabilities who are seniors, who are children, of course, have childcare, or people who have substance abuse issues or disabilities. So that is what we talked about in here, using those ways to create a better difference in the community.
Thank you, Wilson.
Thank you.
Yeah, something that came up for lots of folks in our group was on the question of how do I relate to public safety? I think quite a few people were coming from the perspective of being in a moment where you want to call for help for someone else. In our group, this came up quite a bit, and being in some cases devastated by the options, wanting to call someone who can you see harm or crisis or the potential for harm and wanting to get help, but wanting to do that in a way that won't perpetuate harm. And several people had experiences of knowing going into a situation that the police showing up would escalate, would cause more harm, but just literally didn't know what to do in that moment. And so called the police, didn't know what other options there were, or, yeah, they know we have an alternative intervention officer downtown, but it was after hours and that person wasn't available. And just this sense of, who do I call? Literally, what do I do in that moment? So several people were speaking from that place. Also from people who work with marginalized and criminalized populations in different capacities or have been part of them or identify with those groups. And the theme that came up was this idea that the folks who are most vulnerable are also perceived as the threat at times, and how we rely on the jail as sort of the only safe place for people to go who are the most vulnerable. So that came up. And so in terms of the steps for moving forward, one big idea was we need more education about what is out there, that there are some alternatives already, but it's not as accessible or as easy to know how to access that. So how do we get public education about what is out there? And then where are the service gaps? Are there times of day, areas of town where you can't get service? How do we fund more services to fill those gaps? And then just looking at the challenges around, I'm losing my train of thought here. But yeah, so a lot of the solutions we talked about were coming from that place. And then this was really big. This came up in many ways, but really listening to the communities that are most impacted by the problem we're trying to solve. So if it's unhoused folks, really listening to how are they already addressing their public safety needs, and understanding that there's so much knowledge about among people who are most impacted, and really letting that knowledge lead our steps.
Thank you.
There are plenty of similarities in our group to what the other groups have brought up, where I think in terms of some of the ideas that came about, to me, it sounded like they sort of covered a couple of different things, one of which was especially talking about trying to prevent some of these problems, or some of the things that come up before they become sort of crises, or things where we have to have some kind of intervention that goes beyond that. And so some of those more preventative things was talking about maybe like equitably funded schools. So rather than having like wealth segregation, or having people essentially like who already have wealth have these schools that have all the resources compared to things. So like that was one thing that came up. Another thing was just people having safe places to go, and that's not just necessarily like homes, but also other spaces, and the importance of having more than one safe space to go, because sometimes even if you do have like a safe space to go, that might not always feel safe to you. It might not always be the appropriate place to go, and so not just having like one place, but also multiple places where people can be safe and just be whenever they need to be is a really important piece. Also, supports for people who are having difficulty at work. This came up in a couple of different ways. One of which was if you are a worker and feeling you're not supported by the people around you, you're not supported by like bosses, administration, that sort of thing, then that can make you feel kind of unsafe in your work and make it very difficult for you to continue to show up to work and be able to engage in ways that are appropriate. But also, like thinking about that in terms of people, even if you are struggling with other kinds of things that are making it difficult for you to do your job effectively, it's not necessarily about feeling like the people in the administration is not supportive, but even trying to think through like how can you have those conversations about the things you're struggling with if you are in a work environment, or if you are having life problems outside of work. How can you talk about those things at work in a way where you can be supported and maintain your work can be a really important piece. And so just having those supports for people to be able to maintain jobs while dealing with other life things is a really important aspect also. And also like violent crime prevention came up, and so possibly having community-based conflict resolution initiatives, again, making it a lot easier to deal with these things on the front end and trying to prevent them rather than trying to deal with it after it happens. And then another thing was trying to have more opportunities for people to learn about things. So one idea that came about was to have kids visit like a homeless shelter, other kinds of places, so that they can really engage and learn about people and humanize them and understand some of those things. So that again, it doesn't feel as scary, but also we're talking about how much that can really benefit people in those places too, because the presence of kids sometimes can really affect things in a positive way for everyone's feeling of safety in a certain setting. So those are some of the more preventative things. And then some of the interventions we talked about were, holding service providers accountable for letting people go who are still vulnerable. So not releasing people just because they don't have ability to pay, or having pay be such a barrier to services. And having mobile crisis initiative or a phone tree, including like 988, which is something that SAMHSA is putting together, which is Substance Abuse Mental Health Service Administration. I forget the exact name of the acronym, but having teams to respond to things in a way that's helpful was another thing that came up. And then one thing that was mentioned was to reach the streets, you have to be on the streets organizing. And so having people actually directly engaging in spaces where they're trying to do this work can be a really important thing, and not just doing things based on more theoretical things, but actually like directly engaging in the work where it's happening can be a really important piece. And then lastly, I just want to bring up the concerns about having those crisis intervention teams that are unarmed or don't have like armor, those kinds of things. One thing that people brought up was just the concern for the safety of the interveners or the unintended consequences there, and some of the safety concerns around that for people who are trying to intervene in those ways. But also one of the things that makes it really difficult is the feelings that people have when they feel like the things that they are using to feel protected or feel safe also can feel threatening to other people. So one of those things that was brought up was knives. So like the presence of knives being something that is being seen more in certain shelters, but partly because people are trying to protect themselves, but at the same time, it's also making the people around them feel less safe. And so the presence of the things that are making people feel safe also causing people to feel unsafe is a really difficult tension.
Thank you.
Thank you.
All right, so I think that in my group, one of the big things that came up was a discussion about being proactive versus reactive. And I think that this ended up tying into a lot of what other people were talking about, in how do we become more proactive, and what issues led us to where we are today that have created a public safety response that's reactive instead of proactive. So we talked about how to overcome this through education and understanding how we ended up where we are today and why we ended up where we are today. So what caused these discrepancies in public safety, and that sort of led to a topic on dehumanization and how that ends up leading to marginalized groups, and those people end up being left out of the conversation. So then you end up with public safety responses that are serving one group and not everybody. So we felt that education was really important in overcoming this. and public training, making sure that everybody understands how to respond if there's a crisis in public and you're around. And that would sort of help lessen dependency on armed police officers as well. And also allocating resources. That's something that came up over and over. And there's tension in how do you allocate resources? How does that happen? So a lot of talk about grassroots organization, getting on the ground. So somebody said, I can't remember the exact wording and I don't want to butcher it, but somebody who went before me said you have to be in the streets to talk about the streets. So that came up, and that led to conversation about who's in the room today, who's being represented and who isn't. So it was a good conversation, and we also talked about a lot about interconnectedness and about how all of these issues end up being interconnected, and you have to focus on solving a lot of them to end up getting to the root of public safety. So it was a good discussion. Thank you, guys.
Yeah, thank you.
Thank you so much. Right, so I think we're on slide 4. It's next steps. Thank you for sharing those themes from the breakout groups. Our next steps are to continue our community outreach during the month of April to make sure we have listened to everyone in our community who has thoughts to share on this topic before moving forward. Then in May, we plan to put together our final analysis and recommendations into a report that we will submit to the CAPS Commission for review, discussion, and voting. If our recommendations are approved by the commission, then they will be sent to the city as recommendations for the Common Council and/or Mayor's office. There are lots of chances for public comment along the way, but certainly contacting us now during our outreach period is the best way for your ideas to be included in our work. Next slide.
Now for the pre-event survey results. So of the people who registered to attend this event online, the vast majority, or 21 people, were longtime residents of Bloomington who have lived here for over 10 years.
Pre-event survey. Do you consider yourself a member of a marginalized group? 20%, or 1 in 5 people, said yes, while the majority said no. Around 15% either weren't sure or preferred not to say.
Next slide. Our last 2 pre-event survey questions asked registrants to share with us your experiences around threats to your safety versus perceptions around threats to safety. As expected, there was a large discrepancy in a few threat areas between actual experienced threats to safety and the perceptions that people have about threats to their safety. And I'm sorry, it's kind of small for you to read. The first question asked, which of the following dangers have you or your family directly experienced while in Bloomington? And as you can see, the top 3 were pandemics, unsafe traffic, and lack of access to health care, including mental health care and drug treatment. When we asked a similar question about which dangers you view as ongoing threats, perception of your and your family's safety while living in Bloomington, now the top 3 were traffic again, but then property damage and lack of access to health care. So that stayed the same as well. I found it interesting to note that while most of the threats were perceived higher than were actually experienced, there was one singular distinction. Pandemics were not perceived by 17 respondents as an ongoing threat, although they had already experienced them while living here. In contrast, crimes against people or violence was cited by 11 more people as an ongoing threat than had actually experienced violence while living in Bloomington.
Now for a key institutional stakeholder outreach. First, I want to preface this by saying we value the privacy and confidentiality of everyone who has met with us. So while we cannot share who exactly we have talked with so far, it has included representatives from city officials, other operational stakeholders, agencies, and advocates working with marginalized people every day, business leaders, and real estate professionals. Here is just one question we asked them, aggregated for comparison to our pre-event survey data on the same question. When we asked our city key institutional stakeholders on public safety, which are the greatest dangers or threats to public safety, the top two cited were mental illness and drug use, which correlates to the category on our pre-event survey of lack of health care, including mental health care and drug treatment, which you may remember was around the third highest actually experienced danger by our event attendees. One interesting area to note is that our institutional stakeholders also perceive threats of violence, especially by guns, as a major threat to public safety in Bloomington, while our attendees stated that violence was one of the lower experienced threats in their safety. So if there are some lessons to take away from this data we have analyzed so far, it may be that violence or crimes against people is a smaller threat in reality than it is perceived to be, both by members of our community and by key institutional stakeholders. Also, lack of access to health care, mental health care, and drug treatment are major threats to public safety in Bloomington. And this is not only known by our community members, but it is widely acknowledged by many of our city's top institutional leaders.
With all this said, where do we go from here? Now that we have identified some of the key drivers of crime and insecurity, how can we come together as a community to solve our own problems in a way that makes all of us safer? We urge you to talk about these problems in our community with others that you know, in your family, your workplace, at your place of worship, at school, or in your college classroom. Ask others how they think we should solve these problems. It most certainly will not be easy to change our system to include everyone living here into the sphere of those who are protected by our institutions of public safety. However, our committee is determined to not stop until we have achieved this very goal. Thanks again for your participation in this process of change. And please help us keep the conversation going until our community has truly achieved safety for all at the expense of none. I'd like to thank everyone who helped make this event so accessible, especially our wonderful volunteers from CJAM, Help Ourselves, and Net Impact, and our staff liaison, Ash Kulak. Thank you, everyone, for attending today.
That's it. Thank you all for coming.
Thank you.